So I'm Tracy Robinson, I'm a Macmillan Head and Neck Nurse Specialist.
And I'm Richard Moody, I'm a Macmillan Information and Support Officer.
If we could just move on to the next slide, please. And we'd like to tell you a little bit this afternoon about who the H.O.P.E team are at University Hospitals of Leicester. And so as you can see there are just some photos of some of us, but we are much bigger. So if you'd like to move on to the next slide. Thank you. So a little bit of history into why we developed the H.O.P.E team. So the evolution of the National Personalised Care and Cancer Agenda led to much debate as to how as a trust team we could support patients living with cancer and living with the consequences of their cancer treatments, especially as the patients come towards the end. A lot of our CNS teams reported that contacts with patients often increased following treatment, with concerns about side effects, emotional needs and the fear of recurrence. So along with our Macmillan Lead Cancer Nurse Specialists and our allied healthcare professionals, we committed to training and delivering the H.O.P.E programme. Next slide, please. H.O.P.E stands for Helping Overcome Problems Effectively. It's developed by the Coventry University Macmillan Cancer Support, and it's designed to help people who have had or have cancer, to get on with their lives. The programme is delivered over 6 weeks, with sessions lasting 2.5 hours. It concentrates on focusing and rediscovering inner strengths, resilience to help you cope emotionally, psychologically and practically. Time is spent with 2 facilitators with discussions, group activities. We share information. What we found that actually as the weeks progress, participants develop very close friendships and often help each other with their problems that they have. And we were also able to give them tools to try at home between each sessions. Next slide, please.
So why did we need to form a team? Why did we need the H.O.P.E team? Well, within Leicester and Rutland, there are over 31,000 people living with and beyond cancer, and this is going to rise to 49,000 by 2030. Any number of evidence suggests that more needs to be done to meet people's needs and support them to live well with a diagnosis of cancer. And as Tracy's mentioned, it'll be part of the personalised care and cancer interventions. We were also led by the results of the National Cancer Patient Experience Survey, which again was saying more needs to be done to support these patients. So it was decided that as a team we develop a team of trained facilitators to develop the H.O.P.E Help Overcoming Problems Effectively programme. Next slide, please. So how did we do this? Well, these slides were done back in March. We've got maybe more than 15 in the team now. It varies slightly. They are mainly clinical nurse specialists and radiographers and information officers, but the commonality is that we've all been trained as H.O.P.E facilitators, and that's Tracy and I are here today, not in our roles as information officer or clinical nurse specialist, but as H.O.P.E facilitators. The courses and the team are coordinated within the Information Support Centre here. So here in the Information Centre, we have a team within the centre that does a lot of the administration. So far, we delivered 18 courses across the 3 hospital sites so that people from different areas to improve accessibility. And we also did one trial course in the community in one of our local towns, Loughborough, to see if that would improve accessibility for people who perhaps didn't want to travel into the city of Leicester. Next slide, please.
Okay, so the main reason that we as a team are so passionate about the H.O.P.E course is the difference it makes to patient experience, and this is reflected in the feedback that we receive. So as you can see there, patients have said that it's helped them come to terms with their new life slowly, and it's reinstated their confidence. I think the most important for me as a facilitator is that actually it shows that patients, it's okay not to be okay. It's okay to struggle with side effects, and being a facilitator and being part of a team, we're able to help patients to understand that and learn how to deal with that and using the tools and techniques that we give them, not only manage that as an individual, but manage that with their families and their loved ones at home as well. Next slide, please. Patients are all given pre and post course questionnaires. The next 3 slides really show the impact the course has on patients' lives in terms of how they felt before and how they felt afterwards. You can see here that obviously patients before really did feel that they weren't able to get support and share their experiences. After the course, 27% said that they were able to do this all of the time. Next slide, please. Again, here, this shows a big impact that we're able to give patients or participants skills to manage their life after cancer treatment. And again, the next slide, please. And I think this one is probably one of the most important outcomes for patients, that they start the course really feeling quite lost, I think, sometimes, and the team are able to make them feel that they can make plans for the rest of their life and take away that fear that they're not going to cope any longer, and this just shows that. Next slide, please.
So the next slide is just what our plans for the future are. With the impact of COVID, we are very excited to be working with Macmillan on a pilot of a virtual H.O.P.E course for the people of Leicester, Leicestershire and Rutland. We also want, there is one of these courses specifically for carers, very similar but for carers, and we're going to explore the possibility of running one of those locally, possibly virtually, we don't know. And we do, Tracy and I and others do continue to share our learning with other UK H.O.P.E facilitators across the East Midlands and further afield. And Tracy and I went to Bristol about a year ago, and we can now assess the facilitators so that we can do that in-house, which has made a big difference. We don't have to rely on an outside organisation for that. Next slide. It's just to say thank you very much for listening. This is a picture. Our chief nurse for UHL is Carolyn Fox. She's in the middle there, and then on the left in the dark colour, that's Jane Pickard, who's outside listening to us. She is our lead cancer nurse for Leicester, and she has been so supportive of this whole process. Without her and her pressure on because we're all very from different parts of the hospital and the organisation, without her helping in getting the nurses' time and our time, we wouldn't really have got very far without that. We imagine that there will be lots of questions and we will be very happy to answer them. One final thing is, I think we're the only ones today that I've seen wearing masks. We are locked down Leicester, so we felt that was appropriate. Thank you very much for listening.